welcome to our Glow and Tell Live MOXI event. I'm Ann.
I'm Sarah.
I'm Katie.
And I'm Angie.
And we are the laser specialists here at our medical spa.
Stick around for our Q&A session where we'll discuss all your laser questions.
And we're super excited because we're going to be giving away a free MOXI. So stay till the end so you can be enrolled in the drawing.
MOXI is a non-ablative fractionated laser that works on polishing the skin, just giving it a refreshed look. And it also is brightening for the skin, helps with reducing pigmentation and melasma, and it reduces the pores also. So typically that treatment is done in a series of 3 for best results, and those are usually going to be about 4 to 6 weeks apart from one another. And it's a fast and easy treatment. It takes very little time here in the office. We do usually put a little bit of numbing cream on, but the actual treatment to the full face only takes maybe about 7 minutes, so it goes really, really quickly. And it has very minimal downtime. So most people can put their makeup on after about 24 hours. Definitely your sunscreen can go on after 24 hours. And we can do this treatment year round, which is another great benefit.
With MOXI, there's very little downtime. You will have a couple days of maybe some swelling. We ask you not to wear makeup. However, this is one laser that we can stack, which means we can do multiple lasers. So we could do MOXI with a BBL, which is broadband light. We could do MOXI with other ablative lasers. And whenever we add anything in, it's always going to cause you to have a little bit more downtime, maybe a few more days without makeup. But really, it's very, very easy downtime.
So today is my day 3 post MOXI. I'm feeling pretty good. I don't know what you can see. Got little brown dots. My skin feels very sandpaper-like. But as far as care right now, I'm just hydrating after using a gentle cleanser. Then I'm using a gentle moisturizer and sunscreen. And I would say I can apply my normal makeup within probably 2 more days. I just don't like to do it because it feels uncomfortable for the first couple of days because your skin is very sandpaper-like. But it's quite easy. Immediately following the treatment, I felt a little hot for about an hour, but not bad at all. Very minimal swelling under the eyes, and then that's pretty much it. Easy peasy.
So MOXI is good for everyone. We can treat all skin types with it. It is a very gentle, low-density laser, so it's not going to heat the skin up too much or cause concerns of hyperpigmentation. So it is especially good for our melasma patients. You can use it in dark skin types. It is a great entry-level laser because it does have a small amount of downtime with it. And it's also good as a maintenance laser to any of your bigger lasers like halo or full resurfacing lasers.
Thank you for taking the time out of your evening to join us for our live MOXI event.
We would love to hear from you, so if you have questions, please place them in the question box, and we will answer those live shortly.
Be sure to stick around to the very end. You're almost there to get entered to win the free MOXI, which will be announced tomorrow.
And as a thank you for everyone attending, we have an introductory price for anyone who would like to try the treatment. It will be $575. Regular price is $650.
Really? Oh boy, here we go.
Hi, welcome
Hi,
to our
everybody.
MOXI live event.
Thanks for joining us. I'm Katie.
I'm Ann.
I'm Angie.
Yeah, so thank you for tuning in and watching our video and getting some information about MOXI laser. So we're going to go ahead and open this up for some live Q&A. So you can go ahead and type in the chat what kind of questions you might have about the MOXI that maybe we didn't cover in some of that video, or if you want some more in-depth questions, things like that, then we can definitely answer some of those for you. I know I had a MOXI not that long ago. Katie had a MOXI not that long ago. Angie had a different laser that not that long ago.
I needed a little bit stronger.
She can comment on that one. But anyway, so I know I loved my MOXI within a week. I loved my pores were minimized, pigment evened out, and it was just a very easy, fast treatment. So yeah, I thought it was a great maintenance treatment for me. So
Same. I had the same experience. My pores were visibly better within probably a week, and it just skin looked polished. It really, really looked nice. And the lighter pigment on my face that we had a hard time getting rid of with other modalities, it was pretty nice.
Yeah,
pretty nice. So.
And I know that Sarah, one of our other nurses, she has melasma, which is that kind of where you get the patches, more hormone dependent pigmentation. So a little bit different than regular sun damage, and it's very, very tough to treat. And so we are treating her with a series of MOXIs in order to work and help break some of that pigment up. And she's getting some really good clearance of her melasma with that. So, which is kind of like it's kind of like the gold standard for the MOXI. It's kind of one of the main reasons that we really love that treatment, is because it's one of the only lasers out there that really can help improve melasma. It's very tough to treat. And so it was just kind of something that was missing in our tool belt, so to speak. And so so we're really happy to have this treatment. So yeah. So with that being said, I guess I can be quiet now and you can answer your questions.
All right, well, we have a bunch of questions already rolling in. So maybe if we can kind of back up just a little bit, just kind of a high level overview of MOXI and what it is and what it's good for kind of across the board.
Okay. Well, so MOXI is a different wavelength than the others, which is why it's good at getting superficial pigment and pores. It's actually the 1927 wavelength, which is really different than anything else on the market. And it's going a little bit more for what's at the surface, deeper than what you get with BBL or broadband light treatment. However, more at the surface than halo. So it's better. It's what I immediately think of if somebody wants to do a laser for the first time, and something that has a little bit more downtime than a broadband light or BBL. First thing that comes to mind, if you have melasma, that's what I'm absolutely going to recommend.
I think MOXI too is great for that patient who's trying to be preventative. They don't maybe have any certain skincare concerns, but they want to maintain what they have. MOXI is perfect for that. Maintenance, preventative.
And maintenance for myself, I usually do a deeper, like a halo or something once a year. But I don't necessarily have the downtime to do that, several times a year. So this is a nice little cleanup, polishing effect in between that's really very, very easy and quick to do and put into your schedule. So it's also probably one of my favorites so far for men. I think men really respond really well with this because guys, you just don't want a bunch of downtime and things like that. And so you want to be able to have this done on Monday and be out playing golf on the weekend, and so that's fine with your sunscreen on, of course. Right. But it just gives them a nice little clean up and refreshed, polished look to their skin, because you guys need to have some polished skin too.
Awesome. How often should you get a laser treatment done?
Depends on what laser. Generally, the deeper lasers, you probably maybe once a year. MOXI, I think it depends on what you're trying to achieve with it. If you're trying to just, polish up for an event, look a little better, your pores, I think one a year. But with MOXI, I think if we're treating melasma, you need a series.
Or if you've never had any kind of lasers or anything before, it's usually better to do things in a series in order to get good results. And so, so those would be, every 4 to 6 weeks. Usually a series of 3 seems to be the kind of gold standard, pretty easy to squeeze into the schedule.
When we talk about downtime, I did want to mention we've done a lot of combination treatments with broadband
Which
light,
is the laser stacking that we talk
stacking.
about.
And that just to put it out there, if we do decide to do that, and that's something we would definitely talk to you about at that time, but it does up the downtime quite a bit. People tend to be
Have a little bit more swelling.
a little more swelling, a little bit, and beyond that, it seems like things clean up nicer and faster in the long run. Like at day 4 or 5, you look like great, like it's pretty well in fast forward, but the first few days look a little bit rough, a little more beat up.
Yeah, and sometimes with swelling also, like a lot of times I will ask my patients, do you let's say you get a mosquito bite, what happens? Do you swell up? I swell up. I get these big old bumps welts and everything like that. And so I know that I have a very strong reactive skin or a histamine response.
Right.
And so I know when I do my lasers, I am going to swell those first couple days. Now with MOXI, when I have halo, I swell pretty good. If I do, MOXI, and I was a little swollen. I knew I was swollen. I don't think other people would have looked at me and said, especially people that don't see me on a daily basis, they wouldn't know that I was swollen. They might have thought I went and had a margarita heavy on the salt or something the night before or something. Who knows? But it was not, for me, anything to write home about. But if I probably would have done a really good BBL and my MOXI at the exact same time, where I was really focusing on some, collagen production under the eyes, then I probably would have had a little bit more swelling, just because I know that that's my histamine response. So.
Yeah. And once we meet with you, decide what the best treatment is for your goals, we are very transparent when it comes to the downtime. If we're going to use 2 lasers, we're going to tell you if you need an extra day of downtime or if you're going to swell a little bit more using the combination lasers. So you won't go in being surprised. We're very upfront about all that.
Yeah. Prepare you for the worst. And if it's less than that, then
pleasantly
everybody's
surprised.
happy. Yeah.
Yep.
Awesome. All right, I'm seeing a lot of the same questions, so let's see if we can do this one. Does this replace your Botox treatments?
No.
No, not at all.
All right.
No, so Botox is working on the muscle action, movement, lines, wrinkles, things like that. So whenever you frown, whenever you raise your eyebrows, whenever you smile, you're creating this, it's almost like a piece of paper that's being folded over and over and over again. And so you kind of get these little cracks that form in the skin over time as you've been doing that for decades, right? And so Botox and Dysport, Xeomin, Daxi, all those what we call neuromodulators, those are the only way that we treat those wrinkles. There's nothing else out there.
Right.
You can't have surgery that's going to get rid of it. You can't, there's nothing else out there that does that. So it doesn't take the place of that, but it is a nice little adjunctive, because Botox doesn't necessarily help with the quality of your skin. Botox isn't going to necessarily help with, your pores and things like that, or your pigmentation, things like that. So, it's a nice little, I love it when my patients, will do both their Botox to help get rid of some of the wrinkles and smooth the skin out. But then if you work on your quality of your skin, you get such a much better result, because, working on your evenness of tone and your pore size, some of the fine lines, textures, things like that, it really makes a big difference on your overall end result. So
if what they're asking though is, does it replace preventative Botox? Maybe that's what they're
like on the
for.
younger
like
patient.
If you're
like in your young 20s or
Right,
something
right.
like that, and they're doing what they
maybe.
like to call baby Botox. Yeah, right.
Then in
Then
that
it could-
case, I would say, it would depend upon the person, but if you're at the point where you're like, I'm not sure if I want to try it, that kind of thing, and
It'd be
you don't
something
really
like
have
a
any
little
lines that stay, you just have the lines that form when you animate or when you say raise your brows.
Right.
Yeah, maybe that would be something that we could talk about. But unfortunately, nothing replaces Botox.
Mhm.
So
Botox is life.
Yeah.
So follow up to
It is.
Botox.
It is.
Yes, yes.
It just is.
A follow up to the Botox question: how soon after you get a MOXI can you get Botox?
We usually say 2 weeks between laser treatments, before or after.
Next question I'm seeing a lot of, and it's your guys' favorite, is laser stacking. Yeah, you guys love a laser stack. What other lasers can stack with MOXI?
A lot actually. So probably our
Biggest
one would be the BBL, which stands, as we said, broadband light. I always like to say not to be confused with the Brazilian butt lift.
Right.
Okay, so the BBL works on browns and reds in the skin, collagen production. That by itself doesn't typically have any downtime, and I think, you know, pretty much anybody in their young 30s should be doing that at least twice a year. And then as we get older, every decade, we should probably add another one throughout the year. So 3 to 4 times a year it's a great maintenance treatment. But if we're going to take it up a notch and add some treatments for texture and, like we said, pores, things like that, then that would be when we would throw in the MOXI along with it. The other beauty of MOXI that we didn't talk about, and as far as laser stacking, so we're big fans of BBL to face, neck, chest, hands, arms, all the areas. And so MOXI also can be used on face, neck, chest, hands, things like that. And it's so fast. The actual treatment, like for face, is anywhere from 5 to 7 minutes.
Yeah.
Same thing for the neck. And so it's like, it's so
It'll
easy
take
to just
longer to
add it
numb
in. So
than it will to actually do the treatment.
yeah, right. So other treatments, yes. See, we could do, you know, I mean, gosh, we could do profractional, we could do halo, we could do micro laser peels, you know, all kinds of others. It all depends on what we're trying to address, but we can pretty much stack pretty much any other laser that we have with MOXI.
Okay. Other questions I'm seeing a lot of is about hyperpigmentation. Are we seeing that after they have that the MOXI procedure done at all? Any concerns there?
No, not at all.
All right.
And we can treat all skin types,
Yes.
color,
All year round.
Yeah.
Which is nice.
All right. Let's see. We've got a few more questions, and then do you guys want to talk about our special?
Sure.
Yeah.
Absolutely.
We have an introductory offer. Y'all want to get in on?
No. So for everybody watching today, we definitely will extend our offer of it's $575. Normally, MOXI to the first area is $650. If you decide to add another area, so say your neck or your chest, hands, whatever, it's another $150 to add that second area on. So it's kind of a great time to get, you know, 2 areas. Take advantage of it. It's not, you know, it's a great discount already. With you watching tonight, you definitely can get that first area for $575. And then, like we said, you can always add on the neck or chest or hands or whatever for $150 with that as well. So, and also be sure to stay to the very end as well, because we will be raffling off a MOXI. That'll be announced tomorrow, but we will definitely be raffling off one of those as well. So.
Who doesn't want to win?
Right. Katie, how is your face doing since you had, like, we did that video a week or so ago. How's your face doing now?
It's great. It's nice. The mins that you create, so there's some, the pigment that comes up in like a sandy kind of a texture, and as that comes off, yeah, it's nice. It's polished underneath. It feels really good.
The makeup goes on good.
Yeah,
really nice.
Yeah. Good little glow to the skin for sure.
Yeah.
Yep.
All right. A couple more questions and then we will talk about the giveaway. Does it help with scarring at all?
I wouldn't say that this would be my go-to for scarring. I think, you know, we have other modalities that are kind of, you know, what I go to first, like my profractional, sometimes halo, sometimes microneedling. That's usually, it depends on the type of scarring. If we're talking about acne scarring versus a scar from a surgical, things like that. We have different lasers. Again, we have multiple tools in our tool belt. And so that's the beauty of these lasers, is that, sometimes one size doesn't fit all. And so sometimes we will pull out 3 different lasers at one time to address one thing. So it just depends on what we need to do in order to get you your best results. But yeah, MOXI would not be necessarily my go-to. No. I don't know
Not for
about
scarring.
you guys for scarring. So.
Awesome. Any other thoughts? I think we might have one more question. So we'll reach out. So I had a question come in. Will we get a discount code to use for the giveaway? If you're interested in purchasing the package or the one-time treatment, we can definitely honor that for you when you call and schedule your appointment. Just mention that you watch the virtual live, and we'll get that coordinated for you.
And I didn't talk about, I know I talked about a single treatment at $575, and so there is a package. So like I said, a lot of times we'll recommend a series of 3, and that's $1,600 for the package of 3, just so you know.
Awesome. Well, should we do a giveaway?
Heck yeah.
I love
a giveaway.
Okay. So everybody, we're going to give away a MOXI 1 laser treatment, so a $650 value. What we need you to do is to comment in the chat box. Give me a thumbs up or a yay or a type in MOXI. I like that.
Yeah,
Type in MOXI,
yeah.
and we will pick a winner tomorrow and announce that on our social channels.
And thank you everybody for tuning in and spending your busy evening with us. We appreciate it.
Absolutely.
Hopefully you learned something.
Yeah.
Call us.
Yeah.
If you have more questions.
For sure.
All right.
All right.
All right.
Well, thank
have
you.
A good day. Have a
Good
good
night.
evening. Enjoy your weekend. Until I get you.